to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. So our first action item is the ballot tally for the proposed new board member. So if we have the ballots are somewhere and they can be. So while the ballots are being counted, I'm going to propose that we move on to the next item because it will take them a few minutes and we don't need to have that dead time. And then when we're finished with the next action item, we will come back. So Peggy, I promise you, we will not skip over you. So the next action item is the consent agenda. Now, let me repeat, the way I like to deal with the consent agenda is if there's an item in there that you want to discuss, then I propose that you extract that item for conversation. Then we will proceed with the approval of the bulk of the consent items and then come back to the extracted item. All right. So I'm going to entertain extraction. Oh, hello there, Glenn.
Hi.
So I'm going to entertain extraction of one of the consent agenda items. Are there any takers? Let me say that I review all of these before this meeting and go over them carefully with Eric. So as your chairman, I have actually looked at them and thought about them. But I want to open it up to any board member. If you want to extract any of those items, feel free. Going a third time, any extractions? All right, hearing none, then let me take a motion to accept the consent agenda.
Mr. Chairman, this is Glenn Bailey. I'd make a motion that we approve the consent agenda as here presented.
Thank you. Do I hear a second? A second. Okay. Hearing, if you oppose the action item, please speak. Otherwise, if your silence will be considered a affirmation of the action item. Okay, hearing none, the consent agenda is approved. Jessica, do we have a tally? Still working on it. Well, the quarterly fiscal report will actually take some time. Why don't we go ahead and do the tally, and then you have the floor for as long as you want. Oh, it'll be brief? Well, yeah, I still want to do it in that order. I want to give you free time. For those who are not in the room, we're physically counting the pieces of paper, the tallies. Two more to go. We're almost there. Wow. Drum beat. Don't cut yourself. Okay, wonderful. Well, it would appear that it is Nearly unanimous. You have 12 votes, so you're in. Okay, congratulations. You're on the board. All right. Um, the fiscal report. Christine, you're up.
I just put it on. Thank you. So as usual, we will start with the cash fiscal report. We're reporting for the 6 months ending December 31st. It's not a quarterly report. We just went to a schedule of reporting on a quarterly basis. And we get a quarterly report by board meeting, by report person. So we ended December, and this is after the $470,000 cash transfer. We ended December with $7.5 million. That is 8.72 months in reserves prior to any program restricted funds or board committed funds. After we adjust for those board committed funds and program restricted funds, those total $4.1 million, leaving us with uncommitted funds of $3.4 million, or 3.92 months in reserve. If there's no questions there, I will move on to the budget to actual. Budget to actual, again, for the 6 months ending December. In total, our revenue is in excess of budgeted revenue is in excess currently. Keep in mind, it's only 6 months. In a 6-month period, when we're looking at our fiscal year, the first 6 months, the individuals are working on developing their programs, their grants, they're getting ready to implement them. The last 6 months of the fiscal year, we start to see more activities where they're actually doing the implementation and finalizing grants. So we should be seeing more expenditures and revenue coming in the last 6 months of our fiscal year. If we look at licenses, permits, and fees, which is environmental, it is currently over budget in revenues by $61,000. And that should probably narrow as we go through the next 6 months because they sent out all of their food permit fees. So right now, we have greater revenue because a significant chunk of dollars came in over the last couple of months. Health services, this is clinical and epidemiology and also health promotion. We are currently under budget by $32,000. This is primarily related to 3 staffing issues. General support, I have some cleanup to do here. The $21,000 represents rebates that we receive, such as P-card rebates and USAC rebates. That needs to be moved down into the donations miscellaneous category. Other fees, this is our death certificate revenue. It is currently over budget by $3,300. Our grants and contracts over budget by $577,000. And we need to keep in mind that we had a significant amount, actually $605,000 that came in for opioid funding at the beginning of fiscal year 25. Because we don't know those amounts, they're not included in the budget. When the budget is developed in this way. Interest, as I've mentioned before, I was too conservative, which I will probably continue to be too conservative on budgeting for interest. We're over budget by $91,000. Our rent revenue is $14,700. We rent space in several of the outlying offices. And donations miscellaneous, currently under budget by $2,100. So we are in total over budget in revenues by $736 as of December ending. We are under budget in our personnel expenditures by $369,000, under budget in operating expense by $401,000. And this is where we should see maybe the gap narrowing as we get into the next 6 months. Capital expenditures under budget by $66,000. Trustee benefits under budget by $5,000. Total expenditures under budget $841,000 for a total of $1,578,000. So from a cash perspective, we have an excess of $1.3 million. Once we adjust for our accruals, our receivables, and our payables, apply that to the beginning cash balance, we end with the $7.5 million in ending cash. Are there any questions?
How discretionary is that excess cash?
That is not excess cash. Keep in mind, we have in total $7.5 million. Of that $7.5 million, we have $4.1 million that is restricted. We can't use that for any other purpose other than what has been specified for. That leaves us a balance of 3.3 or 3.4 million, 3.92 months in reserves. I truly do not like to go below 3.25 months in reserves, anywhere from 3 to 3.5. I'll settle at 3.25. And the reason for that is for unexpected operating expense. And during COVID, money was going out the door. Now, I know our response will be completely different next time. But it got to the point where we were not getting reimbursed funding on a regular basis. And at times, there can be issues with grants where we don't get paid within 30 days of invoicing. But when it gets too low, we don't have another option. I was to the point of wondering, where do we get money if we don't get our receivables paid? So I truly like to stay within the 3 to 3.5 months in reserves for operating expense.
And I approve of your methodology, so going back to my question, then we have maybe 0.4 in discretion? Or I don't know, it's a question, now you tell me.
I'm going to hedge on that because we need to keep in mind that that number is constantly floating. So possibly. And then the other thing that the reason why I'm hedging here, not being very committal, is as we go into the fiscal year 26 budget season, we have so many unknowns that we're facing. And the primary unknown is funding, because there's a lot of discussion at the state level and the legislative sessions as to what that funding is going to look like. So we have several items that are moving targets as we go into this budget season. So I'm hesitant to say absolutely that, yes, we have 0.4 months in for discretionary purposes.
You know, along those lines, I've heard it said, it's a rumor, I'd be curious to know what you've heard, that the state legislature is looking at reversing some of that Medicaid expenditure. Have you heard that?
Mr. Chairman, I have also, I'm unaware that Director Adams and Director Huffman has a substantial legislative package that he's moving forward, of which I don't know how the details about, but he appears to be wanting to minimize some of the goals of health and welfare impact that this information has
Okay.
some impact on.
So you're right, it's a moving target.
Mhm.
Yeah, I hear you loud and clear. Okay,
Well,
interesting.
Mr. Chairman, so would our understanding be that at the end of this legislative session, you'll have a little bit firmer understanding as to where that's at? Or?
It will be a bit more defined.
Okay.
And again, the reason why I'm hedging here is we often don't get the contracts from VHW until very late in the spring, or oftentimes in June we're pushing contracts through, signing them, trying to get them set up to be effective 7/1. And we don't know until we receive those contracts, the dollars that were awarded. So late in the spring, early June, or in June, we're still a bit in the dark.
If I can add to that, the last year, there are a number of contracts that we've got for years and years, so it's an amendment, it's a continuation of contract. There's discussion that the legislature may take a look at all of those and basically provide 1 year funding. And as we mentioned, if they do that, it's not a simple renewal. We may not find out what contract is going on. In some cases.
Now, when do we establish our budget? Isn't that before that?
So we will be rolling out the budget templates here shortly, and the board gets a draft budget in March. We present the draft in March. We present the our finalized version in April. Once the board says, yes, you can go out to the counties and present it to the counties, Eric and I will start presenting those to the counties in May. Then at the end of May, the budget committee meets and either approves, hopefully, the budget or does not. I've never had a budget in the years that I've been here in this position or in my former position. I've never been aware of a budget that was not approved.
Well, that's good news. But I guess what I'm driving at is, here we're going to establish a budget, and yet there may be legislative phenomena that would have consequence. But sadly, the timing, we're supposed to set up an expense account, and then maybe the legislature will be forthcoming, but then there's no guarantee. Am I understanding the sequence correctly?
You're understanding the sequence correctly. Typically, as how we develop our budget, we develop the budget, the revenue side of things, based on our expectations. And historically, the funding has been level from year to year. We have been seeing declines over the past few years. So we either keep it level, or based on any chatter that we've heard through meetings throughout the year, we will reduce the funding. We'll adjust accordingly based on the information that we have on hand. And then we adjust our expenses accordingly as well. And that's how we develop the budget. And it is challenging because we develop the budget so early in the year that it needs to be approved and in place by 7/1. Keep in mind that after the budget is approved, we can make amendments to the budget, budget modifications. I'm not an advocate of that. In my mind, a budget is a budget. It can never be spot on 100%. So if we have, it's likely that we could potentially base our budget on funding, higher funding than what we actually get. Really, there's no harm in it. Where it becomes more challenging is if we get more funding and our budget is less and our expenses are tied to the lower revenues, we may need to come back to the board and ask for an approval to increase that budget, which increases our spending authority. Because we cannot spend in excess of the budget that was approved. But if the budget was approved at a higher amount than what we actually get, we don't have to seek approval for a lesser budget.
Anyone else have questions? Actually, I've got one for the commissioners here. Just out of curiosity, when do you set your budget? Is it coming up soon also?
We start working on our budget in April, and then the budget is adopted in October. Then June is whenever we finalize it.
Okay, so you're able to modify your budget, um, knowing contingencies coming from the state legislature. Okay, that's interesting. I take it, Bonner County's the same, Glenn? Okay. All right,
Kootenai County's October 1st.
I'm sorry.
Kootenai County's October 1st.
Oh, it's the same thing. Okay, well, that's interesting. Any questions? All right. No, Christine? Yes, go ahead.
Mr. Director, Mr. Chairman, I was just going to mention that the counties operate on a federal fiscal year. We operate on a state fiscal year.
Oh, therein lies the difference, okay.
Yeah. So we're July 1
I
through
didn't know
June
that.
30th. So if there are no other questions, that concludes my report. Thank you.
Well, thank you. All right. The next item is director's report, but let me just make a comment. So with the vacancy of the Benoit board member, Stacy, I'm sorry? I thought she was, oh, Shoshone, you're right, you are correct, absolutely, I'm sorry. We have, the board lost its trustee, so now we are minus a trustee. So we have one new board member, and then Shoshone will add another board member next month. So on the occasion of the February meeting, we should have a full complement of 7 board members. So let me put it out there that I would like to then vote on a replacement trustee in the March meeting. So give thought to that exercise. That's all I wanted to say. Eric, go for it.
Thank you, Mr. Chairman. I just have a few items to bring to the attention of the board today. The first one I have is just sort of an informational bit on the United Way Care Fund. I sat on the committee, the health committee, and those are local funds. That's United Way of North Idaho, and they had less than usual, but they had $26,500, and we reviewed, I believe, around 17 applications seeking that funding, and that was ultimately distributed to 4 entities, with the focus being on mental health. There's a new clubhouse that the National Alliance for Mental Health is setting up in Bonner County. There's a sort of boundary in Bonner County. The focus of that group is to take individuals that have mental health issues and provide them an opportunity to work with counselors and to be productive members of basically to work within the community, as they work through their different challenges. So that will be new up in Bonner and Boundary County. There's additional funding that went to Kootenai Health Foundation's youth treatment program, which benefits all 500 counties and serves youth from 10 to 18 years old. Funding also went to the Shoshone County Women's Resource Center, which is a long-standing organization, as well as the eye care program that St. Vincent Paul operates here locally. So again, that's local funding that is going to stay with these local programs for the benefit of the citizens. I think that the fact that we're addressing mental health issues really does speak to the local citizens of the Arkansas side. The other item I wanted to bring to the attention is I have it's titled Idaho Association of County Directors meeting. I think I potentially gave Jess the wrong title on that, but twice a year the health district directors meet in Boise for an in-person meeting, and usually we have representatives from the governor's office or from different agencies that speak to us. This meeting this winter is going to coincide with the midwinter meeting of the Idaho Association of Counties. I believe that part of the reason for the timing of that is that if if there is legislative action that impacts the health districts, then, and the directors are down there, they may have an opportunity to speak with elected officials to provide input. But we're not aware of anything that's going to be presented. We're not currently aware of anything that's being before this impact. And I guess, Chair, I've asked Jason to cover that meeting for me, because I will not.
If I may, is that the week of 29th to 31st?
That's correct.
Okay.
Yeah. Yeah.
For, if it's of any value, I'll be down to first meetings from the county perspective. So if it's of any benefit, or, you know, like, depending on how to meet with somebody, etc., just let me know if I'll be there.
And, yeah, Mr. Chairman, reviewing the agenda for this budget is not tremendously compelling, but along those lines, we are proceeding, we're supposed to receive weekly updates from Kelly Grassfield as far as if legislative or if legislative action. But, other than what Christine had noted, and Director Adams, legislative action is not available. The last item that I have is just a town hall update. And we may also have some, but we have completed 3 of those. We completed one in Boundary County. We didn't have much of a attendance there. We had a second one in Cooney County where we had, I think, upwards of 16 individuals, and we had commissioners party also was in attendance. And again, the focus of these town halls was to try to solicit feedback from the community on areas where the health district could make modifications, make improvements, those types of things. We also had a meeting in Bonner County, I guess just under 2 weeks ago. We had approximately 29 attendees at that meeting, along with all 3 county commissioners were represented. To date, a lot of the discussion, was regarding some level of historic action by the health district with regards to COVID-19 and masking. There was some discussion on chemtrails up in Bonner County. Today we've had some discussion with regards to waste management traveling through the county or through the health district, risks associated with those actions. And after that Bonner County meeting, I spoke briefly with Commissioner Williams and their planning and zoning, or their planning director, and they have continued interest with the health district role in the transportation and development. So we did get some feedback with regards to that, and as discussed, that is information that we're going to plan here. And that concludes.
Okay, mighty fine. The only thing I would add to that is, on the whole, the town hall meetings have been rather anemic. I'm not sure what that means. You can give it whatever meaning you want. I have my own interpretation, but that's just my interpretation. In any event, thank you, Eric. We're now open to public comments. No public in here, so I'm thinking that will be a short discussion. Folks on the Zoom, do you want to say anything, add anything? You're happy? All right, mighty fine. Well, in that case, I'll take. Oh, yes, sir. I'm sorry.
On our Board of Health calendar schedule, all of the dates are listed, but June 19th is in red. None of the other dates have that red color. Is that an indication of a special meeting of some sort? Or?
Isn't that Juneteenth? That's Juneteenth.
Oh, because of that. Okay.
So we're going to have it? Is, is it a federal holiday?
Well, we,
Oh, then I guess we won't have it. Oh, well, or unless we change the day. Well, that's a good question. Do we want to change the day or just skip a month?
it's interesting, the way that the Kootenai County does it is that they allow individual county departments to vote on whether or not they want to take that day as a vacation or the day after Thanksgiving. And so it's almost like a third of the county is gone for
Oh.
Juneteenth and part of the county goes for the day after Thanksgiving. So I'm not sure how it ranks.
Well, how
for
have we done
intensity.
this historically? I don't know. What's historical?
Mr. Chairman, we've stayed with the state recognized holidays. We've had just that discussion. And I believe we have that discretion, but we don't, with the state recognized holidays.
What do you, let's hear from the commissioners. What do you guys do?
Juneteenth is off. We, the courthouse isn't open. It's federally recognized.
Okay, so I'm going to propose that we take that day off. Now, do we want to just skip that month or go come the next week? I'm open for discussion.
From my understanding, since we're going to be having the planning session on the 10th and then a meeting following up after that on the 15th, it would depend upon budgetary, it would depend upon strategic planning, whether or not we need to call it right away or wait.
Well, that's a good question. Christine, do you see that there would be any urgency with budgetary issues in that month? So there's no urgency.
No, I wouldn't. There needs to be.
Okay, we have a motion to skip that month. Do I hear a second?
I'll second.
Okay. Is there a discussion?
Mr. Chairman, we may need to add this as an action item to the future meeting since it's on the agenda.
Oh, those doggone open meeting law things.
Oh, because you can amend the agenda, but you have to do it together. Correct.
I believe that's correct. And this is, we have some time to work on it.
Okay, so we will cue this up as an action item for next month's meeting. Does that sound reasonable?
Yes.
I have lots to learn as it relates to these open meeting laws. Okay, well, that being said, any other issues folks want to talk about? All right, hearing none, I adjourn the meeting. Oh, no, we were going to take a motion for such. Well, we did, actually. We did take a motion to adjourn. And a second.
I'll second.
Okay, we have a second. Hearing anyone who objects to just adjourning, so speak. Okay, hearing none, the meeting is adjourned. Thank you, everyone. Okay, there you go. Guess this goes for records or something.
And, you have a call in.